My name's Hannah. I'm an MPS, which stands for Mako Product Specialist. And Mako is a surgical robot we use at Stryker, which we acquired in 2013 and have been using in Australia since 2015 for total knee, partial knee and total hip replacements. So every week is different, every day is different. On a Friday we get an outline of what our following week will look like. We have a live document that we use in Victoria and Tassie where we populate all the cases for the following week and they get allocated. So you have a rough idea of what your week will look like, and then from there things will change a little bit with extra cases added or some cases cancelled, but you have a good idea of what that week will look like. Theatre lists are generally a morning list, an afternoon list or an all-day list. The morning lists usually start at 8 AM. Afternoon ones are generally 1:30. So as an MPS, I'll arrive at theatre an hour before. I'll check in and I'll bring the robot into the theatre and run some pre-surge checks. And then I'll check all of our instruments for the operation and our implants and make sure everything's there. And then I'll work with the nurses and make sure they're happy with their trays and support them with anything I can. And then the surgeon will arrive and I'll run the surgeon through the plan for the operation. With a Mako case, the plan is quite involved, so the surgeon will have had a CT scan between 2 and 8 weeks prior to the operation date. And then when that scan is uploaded by a radiology site, we share it with either our US team or our local team. And what they do is they take those images and build a 3D model of that patient's anatomy. And when we get that plan back, what we do is we define some landmarks on that patient's anatomy to set up some axes, and then we optimise the size and the position of that implant for the patient based on what the surgeon's preferences are. We'll do all that planning probably a week or two prior to the operation, but on the day we'll run through that with the surgeon. And because we work with them often, we know what their goals are, but they will also have a look at it and make sure they're happy and tweak it. And then from there, the patient will get draped and the operation will start. And throughout the operation, we're there to support the nurses in the workflow as well as the surgeon. So we really partner with the team in theatre during the case. And the beautiful thing with Mako is what we do is we updating our plan as we go. So with the plan, we're basing all of our decisions off of CT data, which is just the bones, but intra-op we assess the soft tissue and we'll adjust the plan accordingly. So our role in that is just to work with the surgeon on how they want to move the implants around and just guide them as to what's on label, what's off label, if they're a bit newer, and just help them to make sure they're happy with the plan. And then once we're all happy, what we'll do is we'll bring in the robot, and the robot is amazing in the way it will execute our plan exactly as we want it or have set it. And then for the rest of the operation, we just assist in the workflow, and then once it's done, pack up and put away the robot and help nurses with their trays. And that's probably like the gist of being in theatre. And I would say not every case we cover is a Mako case. Sometimes they're conventional, but probably about 80% of the time is spent in theatre. The other 20% is generally spent doing admin or training. So that might look like what I alluded to before in terms of planning surgeries, but then also training. So that might be here in the office with colleagues, if they're newer colleagues, maybe training them up on things that I'm across, or if they're more experienced colleagues, having them train me and upskilling myself. So when I was younger, I was an athlete, and that was a huge part of the start of my career when I was young and also when I was studying. After being an athlete, I was a college diving coach, and that was what I did while I was also juggling my studies. And then once I finished studying, I studied biomedical engineering. I started looking for work in Australia. It was hard finding a job as an engineer in Australia, given there's not a whole lot of R&D done here. But I knew from my studies, when I did my masters, I spent a lot of time observing physicians and emergency doctors, and I knew I wanted to use my engineering skills clinically. When I found out about this role, I knew it was what I was interested in because it was using technology and also helping people, which is was my objective. So I actually did a course through GEMED, which was a stepping stone to get into the industry, and my first role full-time out of college was in the kit room here. I spent about just over a year in that role, and I had gone into that role with the intent of eventually interviewing for my current role. In that role, I had the opportunity to go through what they call the MPS Next pathway at Stryker, and what that entailed was spending 1 day a week in joint replacement while spending the rest of my time in the kit room. And just to elaborate on what that is, the kit room is where we send and receive implants from hospitals. So it's basically a big library of instruments and implants that go back and forth to hospitals to supplement their consignment stock. Or if they're not a big enough hospital to have stock on shelf, it is how they get all their equipment there. And that role was great. It was a very good foundation for me moving forward into my current role. But fast track, I went through that MPS Next program for a couple of months, and then I interviewed for my current role, which is where I am now. My favourite thing about the job is the people I work with. They're wonderful, and I have a lot of really, really good friends at work. I think another thing I love about the job is when I was looking for work, I wanted to be somewhere where I could develop as an individual but also professionally, and I think at Stryker I definitely get that in my team. We've got about 35 people in our Victorian team, and they've all got skills and things that I can learn from. And then also, formally, we learn a lot, and that's been really important for my development, but probably most importantly through my manager in terms of the way he's come alongside me and really supported me in challenging times, but then also pushed me and coached me and developed me. I've really valued that, and that's really important to me. And another thing I love about my job is our customers. Being part of a surgical team and feeling like your presence is important there, and just being able to build those really strong relationships with the surgeon where you can understand their goals, their worries, and try and help them address those is very rewarding. And finally, one of my favourite things about the job is the industry we're working in and where Stryker stands within that industry. We're market leaders when it comes to robotics, and we're #1 in hip and knees in the registry data. And that's really exciting, and I think especially for knees, for me, it is an area of research at the moment. After knee replacements, there are a small percentage of people who are unhappy with their knees, and we are really working with Mako on addressing that. And how we do that is how we plan our cases and how they're executed. And I think working with surgeons and doing a lot of research in this space is a really exciting place to be. So I guess the biggest challenges I find in the role are probably the hours. It's not a strict 9 to 5 job. We're present when the surgeons need us, and sometimes that can mean a late start or it can mean a really long day. And Stryker are great with trying to get you your time back in lieu, but sometimes the days are unpredictable and you've just got to be flexible with that. I think also a challenge is in that operating theatre, when things aren't going well and tensions are high, it can get a little bit stressful, and that is rightly so because we're all trying to get a good outcome for the patient, and when things aren't going well, it's just about finding solutions and just taking a deep breath and figuring out the way forward. And I think sometimes just being resilient and being able to brush the dirt off your knees and keep moving forward is really important. There are lots of benefits for working at Stryker. Firstly, the thing I love the most about working at Stryker is just knowing that our technology is great, and being market leaders, I think it's really easy to do my job and to be proud of what I do, and I think that makes work easy and that makes work fun. Another benefit for me is the training we get. So there's a ton of training involved in becoming an MPS, and just also to learn our product lines and to be able to support a case non-robotically as well, and we're very well supported through that training. And realistically, it probably takes a good 12 months to be trained. Some of that involves weeks in Sydney where you do intensive courses, or learning on the job with colleagues, or doing workshops or online trainings, but there is a lot of training involved and you do feel very well supported. Another benefit of working at Striker is all the opportunities you have internally. So there's a lot of opportunity for career development. For instance, for me, coming from Kit Room, running through the MPS Next program and then being in this role, that's just one example, but I have future goals of where I would like to be, and I feel like I'm supported in my goals, and my manager works really closely with me on making sure I'm taking the steps to get to where I want to be. And then outside of that, there's a lot of opportunity. We have partnership with Operation Smile, where we do some outreach, and then there's also activities where we do fundraising, and we had a team last year this year as well actually, go to Sydney to do the Great Adventure Challenge, which raises money for Starlight. So there's a lot happening, and if you're willing to be involved, there's a lot you can do. So I've done a lot of interviews at Striker, and my biggest piece of advice would be patient. The interview process is lengthy and very thorough, and I would say just keep persisting with it. Something that I wish I had done more of would be practice your interview questions, practice with friends or family, and just practice your answers and really think about what skills you have that you can speak to, because I think a lot of it is being able to sell yourself and being able to talk about yourself, which is probably something no one does often, so it is a skill to practice. And I think specifically advice for this role would be having attention to detail, being resilient, being a team player are all super important.